Good afternoon. I'm Dr. Petrikovsky. I'm professor of obstetrics and gynecology, and the topic of this short video presentation is to give you an update on coronavirus and pregnancy. What's very important to understand is that there is a lot of gossips and a lot of fears around coronavirus, a lot of recommendations that are based on anecdotal evidence. So what I would like to do today is to give you a very brief update on what goes on in the research on coronavirus and pregnancy. What's very important to understand is that we use so-called the best available evidence. There is no really prospective studies, there is no complicated research. First of all, because we don't have time for it now, and any meaningful research takes design, control group studies, and that's something that doesn't exist at this time in the area. There's two aspects I would like to very briefly address that are very important for pregnancy. Number one, is coronavirus can be transmitted from the mother to the baby. The original paper came from China based on a small number of cases, failed to find any viruses in the amniotic fluid or placenta, which was a very important and good news. Now, as research and publications go further, and I really quote you the papers or published in reputable journals such as JAMA, and JAMA Pediatrics reported 3 babies out of 33 that were infected with coronavirus, which means there is a possibility that the baby can get coronavirus. The problem with this particular publication was that the newborns were tested on the 2nd day only. So clearly, it doesn't exclude the possibility that the babies were infected after birth. So at this point, it's still uncertain. We cannot rule out that in some cases coronavirus could be transmitted from the mother to the baby during pregnancy. So we really need to be very alerted to that. The next question very commonly asked regarding breastfeeding, whether mothers with coronavirus can breastfeed. And now I refer you to coronavirus disease 2019 in pregnancy update. And the update is very clear. So far, there is no evidence that coronavirus can transmit through breast milk. So there is no clear recommendations. As far as my own patients at this point, because it's still uncertain, I probably recommend to stay away from breastfeeding until further research data is available. What's also important to understand that coronavirus in pregnancy has very similar symptoms as coronavirus in non-pregnant patients. And to summarize them, that about 80% of patients complain of cough, so-called chest cough, 45 to 60% with fever, about 20 to 30% with breathing difficulties. You also cannot exclude 10 to 15% of gastrointestinal issues such as diarrhea or GU, urological problems such as painful urination, etc. And the last issue I would like to address is various medications that are proposed to use for coronavirus. One of them is chloroquine. I have no personal experience with using this medication in a large number of patients. I definitely aware of numerous criticism regarding the paper that was published by French investigators, but my approach to this is very different. Rather than say whether it should be used because it works, I would probably say, what's the negative part of using the medication? And regarding chloroquine, although I'm not proposing to use it, it's very clear, I can clearly say that the medication is very old. It's from 1945, after the end of the Second World War. And the side effects at this point is very, very low, especially in term short treatment. And there is an anecdotal evidence from individual physician who strongly recommended and discovered some positive results of this particular medication. Thank you very much. As long as we were getting new data, I will try to keep updating you. Thank you for your attention.